Welcome back to Beyond Well Science. I'm Sheila Hamilton and completely thrilled to be joined by Gina Nikkel. Gina is the president and CEO of the Foundation for Excellence in Mental Health Care, and she is also a dear friend. Hi, Gina. It's so good to talk with you.
Hi, Sheila. It's so great to be on with you today.
Thank you so much for your support of Beyond Well and Beyond Well Science. This has been such an incredible partnership, but I want to go back just a little bit into your own background. You're an associate clinical professor of psychiatry at Oregon Health and Science University, and one of the things that I remember really remarkable about your past is that you said one day you woke up to the standard of care just not being where you wanted it to be.
That's absolutely right, Sheila. Basically, back in 2010, after serving many years in many different positions in the mental health field, I read a book called Anatomy of an Epidemic by Robert Whitaker. And basically, Robert isn't a scientist. He's a medical journalist, but a really good medical journalist. And what he did was he reflected the science and the research back to us. He's not going to solve the issues. He wants us in our field to solve the issues. And he was reflecting what the science said, and it wasn't great about our current system.
And so what you have done at the Foundation for Excellence in Mental Health Care is said that we're going to embrace this once radical idea of care that expects recovery. How does that differ from what you would say is the mainstream approach to mental health?
Sure. So the mainstream approach to mental health now, the medical model, is, somebody has an issue and they go to their doctor, often their primary care physician, sometimes a psychiatrist, and they talk about their symptoms and are given a diagnosis and usually put on medication fairly quickly. That has been what we've done. Insurance requires a diagnosis, medication, and then insurance pays for 12 visits once a week for 12 weeks. And that's oversimplifying, but that's usually what happens. What we've learned is that a lot of people can get better quicker if they have wraparound services, meaning you spend more time with them at the beginning of their mental health challenges or perhaps early psychosis or their issues. And that really is what we found is working. And we've had a chance. I've had the privilege since 2011 now to travel the world and see what's working in different countries. And sometimes people do need medication. But more often than not, it's better not to just start out with that and apply different other treatment modalities.
So I want you to also talk about how the foundation supports research that might not otherwise receive funding by other mechanisms.
Sure. So one of the things we did when we formed, a lot of people all over the world got in touch with Bob Whitaker, and he put us in touch with each other. So we are a group of psychiatrists, psychologists, social workers, public policy analysts, people with lived experience, and family members. And we got together and we said the biological piece of the pie is pretty well paid for and researched by the pharmaceutical companies, and that is their next new magic bullet pill. We don't think there is. Maybe there is, but what we know is in a lot of different places, what works well is community and being with people and listening to them in a different way, asking not what is wrong with you, but what has happened to you. And we really have, come together. We have a SAC, a Scientific Advisory Council, that is phenomenal. It's made up from different scientists around the world that are having conversations about, if not the medical model, then what? How do we tweak it? How do we work together to provide a care system that people with lived experience, people who have had mental health issues, want, and that works for them?
Yeah. I want to talk about how some of the recovery-focused methods, Gina, are actually now becoming mainstream. Can you talk about the successes?
Yes, yes. So we have been working on several different arenas, and what is happening is that people are getting into recovery. And what we mean by that is, first of all, language is so important. How we think and how we treat people and the language we use reinforces our biases. And so the first thing people would tell you is be careful of how you use language. People don't like to be labeled as their diagnosis. And quite frankly, they can get better by having a conversation and wrapping services around them. So, for instance, in Finland, Western Lapland, there developed is a treatment modality called, or a way of being with people, I call it, called open dialogue. And open dialogue is a set of principles that brings everybody that is important to that person together. And the person that's having issues is in the room. Maybe they're psychiatrists, psychologists, family members. Maybe not if there's family members or the system has created harm in some way. But this has been studied in Finland, and the 5-year outcomes for first episode crises are phenomenal. 75% of participants are symptom-free after 5 years, and only 20% are on disability and using an antipsychotic medication. That's amazing. But what most of that research has been done by the Finns. And so the UK is now studying that. And we were fortunate enough to get a grant, a matching grant. So we're still raising money for it. We were able to fund the first year,
Wow.
and now we're into the first year. We there are 12 countries that we're bringing together, and we have a contract with the Italians that are starting to research open dialogue in many different countries. We have also have several pilot projects in the United States that are getting really good first results in the first 5 to 8 years.
So one of the things that I love most about what you're doing is that you're connecting philanthropists who often have people that they love with mental health challenges in their lives with these initiatives that are actually changing lives and bringing recovery as a foundational principle to this area of care.
Absolutely. And can I tell you another story?
Yes,
Because
please.
This is what really speaks to my heart, because I've worked in the crisis system for so long and been a mental health administrator for so long. But what I loved is when I first got introduced to the Hearing Voices Network. The Hearing Voices Network was really formulated in Holland, spread to the UK, and for the first 3 years as we were investigating this, all our donors for the Hearing Voices Network were from the UK, and what I heard was, we want our United States brothers and sisters to have this because it works so well. And I had been with people in the hospital who had been diagnosed with schizophrenia or other crises and labels. And, I learned that they would not get better and always be on medication. And they were told that as well. You'll always be sick, you'll always be on medication, you'll never be able to hold down a job, et cetera, et cetera. And what I learned is that is a false narrative. And I have had the privilege of being trained as a Hearing Voices trainer. I would never lead the training myself because I am not a voice hearer, but I am a helper for sure, helping people. But what I've learned, and I've gotten to meet, and now people are working in the Hearing Voices Network, is people that have been in a state hospital, have been labeled with schizophrenia, have been on medication, and not just one or two. I'm talking hundreds of people who have gotten their lives back through the Hearing Voices Network by sitting with, by being with, and learning how to manage their voices. And more importantly, what do those voices emanate from? And usually it's not a mental illness. It's a mental health challenge brought on by trauma. And I now know people who were told that they would never, hold down a job, that they would never be off medication, and they are not on medication. They're holding down jobs, and it's working beautifully. Now, this may not work for everyone, but I'm here to tell you that it's the exception. It's not the exception. It's the rule. People can recover.
Yeah, this is, for me, one of the most exciting things to watch, because I personally believe, Gina, that, in the next decade, this will be the standard of care, not just in the United States, but around the world, because it's just such a more humane and practical way to treat people in their communities with love, with respect, with compassion.
And so the secret is we really need to sit down together, and it needs to not be the medical model versus the recovery model or whatever other language we use, that we really need to sit down and have thoughtful conversations, because I have sat with people that have said, if it wasn't for that medication, I wouldn't be alive today. And I've sat with people that have said, because of that medication, I lost 20 years of my life.
Yeah.
So, there's no blood test or no X-ray to tell you.
Yeah.
Although, the medical model, they're working on brain scans, etc. But in my over 40 years of practice and looking, and certainly the scientists and the psychiatrists and psychologists and people with experience that I've gotten to be with, I certainly see that we need to consider all things and particularly pay attention to the people that have lived it for so many years. There's so much information out there that is exciting. One of the other projects we have, and one of the places, is right here in our backyard. So Dr. Jenny Johnstone from Oregon Health Sciences University is one of the researchers, along with Bonnie Kaplan in Canada and Julia Ruckledge in New Zealand, also Louis Malmadrona in Maine. They are looking, and this is a fund of ours, mental health and nutrition. They are looking at what micronutrients do for ADD and ADHD. And I have to tell you, what they have found out and what they're in the process of studying is amazing. And again, on our website, if you go to our website, www.mentalhealthexcellence.org, we have a video about this. I mean, people and children in particularly, because it's really hard when you give children medication, are getting better with micronutrient formulas and not medications. And to me, what they're learning about early psychosis, ADHD, ADD, some of these is really exciting.
Yeah, no kidding.
If you want to set up a fund, or if you want to learn more about us, we are right in the middle of a drive. We got an $800,000 matching grant, and we've raised most of the money. But we still need a little bit more. You can go to our website, mentalhealthexcellence.org, and it'll pop right up there how to donate. If you go to the second arrow and scroll through, our annual report is there, so you can learn more about us. Now, some of the new news, which is really exciting, we just, again, had our board retreat here, is we have been contacted by some people in Hollywood that are forming what's called the Impact Guild. And the Impact Guild are, foundations and the media, Hollywood, movies, TV, that are looking at how they can be a part of changing the narrative
how wonderful.
Of mental health. And I have been reading scripts for movies that look at language change and what are some of our challenges and what can help people. So I think a lot of this is educating people that, people that hear voices aren't dangerous. In fact, they're more likely to be victims, and how we can get together and have these conversations.
Oh my gosh, that's so exciting. That's wonderful to have it actually move to mainstream, communication and entertainment. That's fantastic.
Yes. And as you can imagine, we get emails and phone calls, every day. And while we're not a referral agency, what we're excited about doing is funding this research and this programs that can help people, and by their choice and their involvement, not to them, but with them and for them.
Well, you're such a great spokesperson, Gina, and you're also just like one of the most passionate, committed leaders that I've ever seen. Thanks again for being with us. And if you want to learn more about the Foundation for Excellence in Mental Health Care, you can just click on the link right now. And we have, of course, the incredible partnership with Beyond Well. If you support Beyond Well and the kind of programming we're bringing, now's the time to become a sustaining member. Thanks again, Gina. Really, really appreciate it.
Thank you, Sheila. Always good to talk with you.